Well, one of the most exciting developments we have seen here at the Institute over the past 10 years is the expanding use of the NCI Charrettes system for policy-related work. The most recent trend is the use of charrettes for projects that link public health and community planning. The people working in public health are playing an increasing role in the neighborhood and comprehensive planning by providing important metrics that link the impacts of land and transportation planning decisions to public health. NCI has been involved with two projects, one for the CDC in Atlanta and the other one for the Rhode Island Department of Health. In Atlanta, NCI trained and coached staff from the Atlanta Regional Commission and South Face to plan and conduct a charrette for the Edgewood Neighborhood MARTA station to create a transit-oriented development plan. The CDC got involved early, went into the neighborhood and conducted a health assessment that gave the neighborhood a clear base case picture of where they stood. This was presented on the first day of the charrette. Then the charrette team, the design team, used the CDC Health Impact Assessment tool when they worked on design, so they could measure, does this design work better than this design, in terms of this health impact. Now in Rhode Island, we worked with the Rhode Island Department State Health Department. They were funded by the CDC to work with comprehensive plans for towns in Rhode Island to infuse health assessment measures into the plans. NCI came in and conducted a 3-day training that was really an on-the-job training for this group. There were staff from the 3 towns along with their partners that created detailed plans for stakeholder outreach, base data collection, all the things that have to be done before the charrette, including an hour-by-hour schedule for the charrettes themselves. All 3 of these charrettes are going to be done by the end of this year. So when you do charrettes for comprehensive planning, the goal is to create a shared community vision as the basis for this comp plan. The charrette uses hypothetical design scenarios to investigate and illustrate the detailed key planning issues that go into the comp plan. And these comp plans, of course, will have a special emphasis on planning decisions that affect public health, such as healthy food and safe walking and cycling to schools. So what you have here is a process that really reflects NCI's charrette system as a holistic approach to planning, because a holistic approach to community planning must, by necessity, include public health measures.